We're going to have a conversation today about integrating direct primary care into your health plan. There's a lot of advantages to it, and we're going to talk to Dr. John what those can be.
That's awesome. Thank you, Peter. The Pulse of Healthcare broadcasts that we're doing right now, we try to do these pretty routinely. Obviously, if you've been in and around the Houston area, you know we've had like one catastrophe after another. We're really waiting on the meteor to hit at any time. We've had flood, we've had hurricane, we have flooding again this week. So we're picking either a meteor or volcanic eruption. I mean something, or major earthquake. I'm hoping none of those things happen. But really, what we want to talk about today is direct primary care, and a lot of people you think it's kind of unique, this concierge medicine, direct primary care, and how that could be integrated or utilized inside of a health plan. So I wanted to dive into that a little bit and talk a little, like you said, a little bit, Peter, about the advantages and disadvantages, if there are any, right?
And I know there are some, so I'm waiting to hear them from you. That education is always helpful.
Waiting with bated breath. There it is, bated breath. So when people engage in a health plan, the traditional thing that they do is they get a network, quote unquote, of providers, primary care, specialists, hospitals, and things like that. Now, in the range of plans, you have, HMO networks, which means you can only go to these doctors, and if you go outside of these doctors, you get no benefits. PPO plans, which are a little broader network, all right? And then they have narrow PPO networks, which is kind of the same as HMO, but just classified a little bit differently. So how does a direct primary care fit into that? So if you're a company and you understand the economics of healthcare, in addition to wanting to engage in what I would personally classify as some of the best medicine when engaging in a plan, then really you ought to consider direct primary care or a concierge physician that works with you, for you, with your group. Now, obviously that means that everybody in your group just can't go to anybody, right? They're literally going to be focusing their core primary care through this physician's office. What's the advantage? Well, the advantage is that physicians that engage in concierge medicine have smaller panels, which means they can stay with you and talk to you longer. They're not the drive-by doctor that's, you go in and then you sit down and it's you're waiting on your appointment. It's supposed to be 11 o'clock and 12 o'clock comes and goes and you're still waiting. And it's the doctor will be with you sometime, and then when they do come in, it's like, oh, well, good to see you, Peter. What are you here for today? You need to get this, and this. Thank you very much. Go see my assistant, and they're gone. And, to me, that's just not the best medicine. Wouldn't it be better, in your opinion, Peter, to go to a doctor that doesn't have a panel of 3 or 4 or 5,000 people? They have a panel of 300, 400.
Absolutely. And I've been the subject of both of those, where I've been in a drive-by doctor and saw him for 2 minutes, saw him for 3 or 4 years, and then I went to a doctor, and I didn't know he was a concierge doctor until I was in that office talking, and the difference was he spent a half hour with me, and it was actually cheaper.
Right. What you end up with is a physician that actually really what I'm going to consider has a full understanding of your medical need. So let's just start there. So I'm working with a doctor who's going to spend the amount of time I need with him because he's not stressed running from one appointment to the next, trying to ring the cash register. What he's trying to do is give me the best medical care available. Plus one, right?
Yep.
Plus two, he's available. Most of these doctors that do concierge medicine are available 24/7, 365, via text, via video call. Now, that doesn't mean we encourage people to call their doctor at 2 in the morning, because they got a little boo-boo on their finger or they're trying to get their prescription refilled. I mean, we want to respect the doctors that are respecting us by providing that availability. But they are there if you're having an after-hours kind of emergency and for us, we don't know what a crisis is sometimes, right?
Right.
I got a sharp pain, blah, blah, blah. Could be indigestion, could be a heart attack. I don't know. They're that safety net that allows me to reach out to them. And then they're the ones that are directing me to the urgent care or to the hospital, to the emergency room. You know what that eliminates when the doctor says you need to go?
Revenue.
Well, first of all, it blocks you from going when you don't need to. So that's easier. That means you save money.
Correct.
But the second part of that is the health plan can't come back and say that was non-emergent care because the doctor sent you.
Correct.
So now the health plan, a lot of times people just show up at the emergency room and they got acid indigestion. That's non-emergent. You could have taken some Pepto, got a Tums, shoot a Rolade, or they jam their finger and it's just a minor sprain. And now we're looking down the throat of a $10,000 emergency room bill when really that was, wrap some tape around it, see me tomorrow morning.
Yeah.
We'll get you a flat X-ray that costs $10, and a finger splint. So it's really about being smart in your medicine and having a doctor that's working with you to be smart with you.
That's absolutely helpful and enlightening. What I don't know is how do you find those kind of doctors?
Well, that's a
I
great.
did it by accident.
Yeah, you can't. You don't actually find them by accident. So there are a lot of doctors that are really working to be independent of the hospitals, independent of these big systems, that are truly your advocate. Those are your direct primary care doctors, and there's associations out there for them. What makes Ovation Health so cool is most of these concierge doctors accept zero insurance. They will take nothing. They only take a cash payment. It's a monthly deal. You pay it to them. And then if you need care outside of them, depending on the level of concierge doctors, they'll help you coordinate it, but you got to pay for it. Well, that's great. But if you're an employer group that wants full major medical, whether that's a group of 5 or a group of 5,000, and you want a major medical plan, but you want the advantages of a concierge doctor, Ovation Health actually integrates directly with those concierge doctors. We literally take whatever it is that they bill monthly and we integrate that into the plan cost so that your concierge doctor isn't on an insurance plan as far as on the rabbit reel of I have to see you, then I have to file a claim, which is expensive, and then it gets paid, 30, 60, 90 days later, because that's how most doctors' offices work.
Yeah.
They get the same payment they would get from you in cash. They're just getting it from us through the plan. The nice thing about that is because they're directly affiliated with us, we actually get to work with these doctors to do a full coordination of your care. So let me go all the way back to the beginning. You got a primary care doctor. He's spending an hour with you as needed, not one time a year, as needed. All right? He's assessing you. He's managing your care at every level. So let's say you're a diabetic or you have some other kind of comorbidity like COPD or whatever. He may not be taking care of that him personally in his office, but he's working with us, the plan, to find and facilitate the right specialist so he's completely in the care loop. So when you go see that rheumatologist or COPD sleep specialist or whatever, all of that data is connected and flows directly back to that primary care doctor who can then assist you in managing that care day to day.
So it's much more of a total care instead of a
Really,
immediate need care.
really a total care deal. And the way those plans are configured, it's really a care first model. So it's not one of these models where, oh, great, I have insurance. I'm sick. Now I got to go to the doctor. Okay, how much is that going to cost me? It's going to cost. I got to pull out $30 or $40 for a copay. Then I got to go sit around and wait on an appointment, and I might be able to get an appointment for, a week, unless I'm really sick. Then they might squeeze me in that day, and so on and so on. Right?
Right.
I got my concierge doctor. I pull my phone out. I shoot them a text. They're talking to me within minutes. They're going to definitely get to me that day. They're going to spend the time I need. They're going to coordinate that care. And then when we get to that care cycle, and it's like, okay, Dr. John, in order to take care of you, you need to make sure you're taking these medications. Well, the reason that people that get sick don't take medications is they may not ever pick up their prescription, or they may not be able to because of the cost, or when they do, they just don't take it. By having a concierge doctor that's totally integrated into your kind of 360 life health, it kind of holds you accountable too, because they're going to be asking you, did you take the medicine that I prescribed you? Did we follow up on that? They're going to be looking at the blood work, so they're going to know. They're going to know. So it's not a disconnected service where, well, I got my primary care from this random doctor in the network, and I got a specialist visit from this random doctor in the network, and they never talk to each other. And then the specialist tells me I need to go get this kind of surgery, and my primary care doesn't even know I had any of that. And then I go back, and they're like, when did that happen, dude? Oh, well, I got that surgery 2 years ago, doc. What? Been great if I'd have known that, because then we could have done some other things or facilitated some other kind of rehabilitation or who knows, right?
So the doctor gets a real picture of the total person and what their needs are,
Absolutely.
and not just the sore knee, if you will, that needs little mending.
It really moves the needle from what I'm going to call reactive care to proactive care.
To quality care.
It really,
high quality care.
Really is high quality care. So if you're talking to me and you're talking about how I would love to engage in what I consider to be some of the best medical delivery, I would definitely say if you're an employer and you're looking for a comprehensive medical plan and you're ready to, kind of move your paradigm away from I need to have this big network of doctors that service me poorly to I really want to focus my attention on, a few doctors that are going to give me and my employees phenomenal service. Definitely engage in, talk about concierge medicine at the primary care level. Work with us over at Evotion Health. We know lots of them. We belong to some of those associations. We know them. They're all over the country, and we're happy to work with those doctors and set your employees up with what I would consider to be some of the premier medicine in the business.
Well, thank you, Dr. John. I think this has been wonderful and certainly educating. I hope everybody listens and understands and can take action on it. Contact us here at Ovation Health, and we'll help guide you along.
Awesome. Thank you, everybody, and we'll be back again for another episode of The Pulse of Healthcare.